For this analysis, we looked to the 3-year survival data of different subgroups that we compared between these trials. The first comparison was that we compared the patients that had a deep pathologic response with extensive surgery versus without extensive surgery. What we saw after 3 years that relapse-free survival rates were 96% for patients with extensive surgery and 93% for patients without extensive surgery. And this metastasis-free survival rates after 3 years were comparable with 98%. So we saw very high survival rates in both groups, and based on this data we concluded that patients with a major pathologic response do it very well without a total lymph node dissection. So the total lymph node dissection can probably omit it safely without affecting survival. And we also concluded, because both of these patient groups did not get any adjuvant therapy, that patients with a major pathologic response probably do not need any adjuvant therapy. On the other hand, we also compared the patients without a pathologic response who received adjuvant systemic therapy versus the patients without adjuvant systemic therapy. And here we saw that instead of 2/3 of patients that relapsed without adjuvant systemic therapy, there was only 1/3 of patients that relapsed with adjuvant systemic therapy. And also the differences for this metastasis-free survival were 50% without adjuvant systemic therapy and 70% this metastasis-free survival for patients with adjuvant systemic therapy. So we saw that both relapse-free survival and this metastasis-free survival were improved by the addition of adjuvant systemic therapy in these patients. And finally, we also did some subgroup analysis for trying to answer the question which adjuvant treatment regimen is the most favorable in patients without a pathologic response. For this, we compared adjuvant immunotherapy, so anti-PD-1, to adjuvant BRAF and MEK inhibition. And based on this analysis, we concluded that adjuvant immunotherapy might be favorable in patients over adjuvant targeted therapy. And we also looked into the effect of adjuvant radiotherapy, and there we saw that patients that do not get adjuvant systemic therapy might have benefit from extra radiotherapy, whereas where you already receive adjuvant systemic therapy, adjuvant radiotherapy might not have any additional benefits.